Hello, everyone, and welcome to the Becker's Health IT and Digital Health Spotlight. I'm Laura Dierda, Vice President and Editor-in-Chief at Becker's Healthcare, and I'm really excited to have with me today Amy Trainor, who is the Vice President and Chief Information Officer at Ochsner Health. I'm so looking forward to this conversation because we've spoken with Amy in the past for our podcast and a variety of other platforms, and she's got some really innovative things that she's doing at Ochsner Health. So this will be a fun conversation. We're going to talk about her journey teams and how, so much of what they're doing on the IT side dovetails into patient experience, staff experience, and all the other things that are going into making the modern healthcare journey today. But before we dive in, I'm wondering, Amy, can you start us off with telling us just a little bit about yourself and your background?
Awesome. Thank you for having me. I'm really excited to be able to do this with you guys and always excited to talk about what we're doing with Journey Teams. I'm Amy Trainor. I have been at Ochsner for, oh gosh, probably like 15 years now. I think 14, almost 15. I've been at the CIO for about a year and 4 or 5 months. So fairly new to the role, but really, really enjoy what I do every day. I love my job. I love my team. We've got a great team who's always willing to do the new and different. So I couldn't start this without really thanking them for always being open to my crazy ideas and new things that I'm always asking, like, hey, can we try this? So really excited to be here, and thanks for having me.
I love that. What a great situation to be in terms of having a team that's flexible, excited to move forward and about all the things that you're trying to do. We must have started just about the same time. I'm at about 15 years at Becker's as well. And
Oh,
so
wow.
this is,
Yeah.
really amazing. What a great time, to be in your career. So awesome. Well, I think first and foremost, can you tell us a little bit more about those journey teams what you really did to create them, and how you implemented them, and then what the results have been?
Awesome. Yeah, no problem. So a journey team is really like an experience team. So I think what we realized as we really wanted to transform and support our customers in different ways, we wanted to really think through how can we look more holistically at the experience. So whether that be a patient, a physician, or a provider, or a clinician, and honestly, even subsections. So managed care patients, how do we need to treat them differently? Or how do we need to think through technology solutions for them differently than others? So really thinking through how do we get away from platforms and think more about the experience that we're delivering with technology. So what that really, we started with a pretty small user-based team. So our digital medicine team, so we have a digital medicine program. The quantity of patients is much smaller. The quantity of users is much smaller, and really got an interdisciplinary group together to figure out like, okay, how can we really reform and transform this experience? And that was really by having four key stakeholders to make decisions to move forward. One is an IS leader, or we are information services. So we feel we deliver services to people, so we like to be called IS, not IT. So an IS leader, a product leader, a scrum master, and a system architect. And how do we take those four people with a scrum team and a build team and really figure out how can we not always just move faster, but make really good decisions for that holistic experience for those users versus if you think open a ticket, the ticket gets bounced around from team to team to team because we're not sure who owns that piece. Where in this instance, we know who owns it. We know who owns the experience. Those tickets and those suggestions or those incidents that are broken all go to that team to really prioritize and evaluate for solutioning. Really interesting, and why so exciting. It was so exciting to work through is that it really, we didn't change hierarchy. So we didn't say, okay, now all of you different, an ambulatory builder and a user experience builder and a digital medicine app builder. We're not going to take you and put you on a different team with a different leader. We think it's really important that you stay reporting to your same platform team, but that you get your work from this other team because you are assigned to that work group or you're assigned to that scrum team. And that was very transformational for us. In a typical healthcare technology shop, most people are working on platform teams. I applaud anybody out there who has adopted this, and I'd love to chat if you've had success, because it's been a big change management for us. But it really does, uh, each of those core team members brings a different positive aspect to the table, which has given us a ton of success. So if I would say the product person really focuses on user stories and long-term outcomes, and really helps us with like the road mapping and the vision for that experience. Where the architect really focuses on like what potential solutions can we create with the technologies that we have, or do we have a gap in technology that we need to look for? The IS leader really says like, here's what we have today. Here's how we can implement this, and this is how we can support this moving forward. And the Scrum Master helps us get the work done. So thinking through how each of those teams can complement each other to find success, we have just seen enormous wins from our customer base. They are bought in. They love the methodology. They are at the table to prioritize the work, which is huge, right? Like if you think about any IS shop across the country, the biggest problem, at least what I've seen, is that we have an enormous amount of work and we don't have enough people or time to do it. So having the business at the table bought into, hey, this is the methodology we're going to take over. This is how we are going to prioritize the work. And if there's an escalation, show me on this roadmap where you believe it will fit in. And that has just changed the perspective of the customer of our department and division, and really changed the way that we've interacted and worked with them from an operational perspective. So I think that was number one. I think second to that, the prioritization becomes much easier with the vision, and really us thinking out that much farther in advance. We're looking out 18 months. Okay, 18 months, like that seems really far. What trumps what? Like, are there opportunities for us to put more things in, or do we need to ask for resources? So really right-sizing what the work looks like, which before this has been very hard. And honestly, we're not fully converted for the teams that are still doing traditional waterfall-based project management. They are still struggling with the same things, and actually wanting to adopt some of the agile methodology in their teams before they even have their journeys live yet. So I would say really unique concept. The wins are very subjective. The work is, I would say we definitely have less defects. We are definitely more planned for the future, and the prioritization has been much easier by all the people involved. So the journeys that we have live so far are our managed care journey, which really manages our population health teams, our digital medicine teams, and our OHP, our Ochsner health plan teams. We also have our partner journey. So we have Connect partners from an Epic perspective. We share our instance of Epic with others. So we have a special team that works on their build and in their management. We have a clinician and physician team that I have just kicked off, and I would say are probably the most challenging, because the number of users that we're managing are much higher, right? Like 20,000 in totality, probably about 20,000 users between those two groups. So prioritization for that number of people and that number of priorities and projects is just a little more complicated. So we are actively like reviewing, like, is this the right way to have it set up? Do we have enough resources dedicated to these teams? And then knowing how successful this has been, really looking at how we could do this for Rev Cycle and our employee experience team next. Like, how do we incorporate the corporate side of the house, looking at all the corporate teams, what tools we have, how do we better utilize some of the tools that already exist, and how do we, prioritize that work for the organization?
That's amazing insight. It certainly seems like, as you mentioned, not, necessarily the easiest transformation. No transformation is easy, but certainly has great results and a lot of potential for continuing to figure out those synergies in different departments. Now, I'm curious, was there anything that you found surprising over the last several months as you've been doing this, and, especially anything that, you had to rethink after initially rolling out?
Yeah, well, that's a great point. We are always rethinking. I think that's part of the win here, is that we know it's not going to be perfect. And some of those teams that we know are larger are going to have more complexities that we've got to manage through. And I think knowing that is really important. I think the other thing is really empowerment of that core team. Because all of the leaders all report up through different hierarchies as well, there is a tendency sometimes to escalate up and out instead of managing in the team. So ensuring that group of people that based off of our guiding principles and IS, like the decisions we want people to make, which is like giving our clinicians time to care, making sure our patients come first, making sure they understand we have a source of truth, that we are empowering them as a group to make a decision to move forward. And when those escalations come, really redirecting them back to, hey, you guys can make these decisions, but this is a democracy, honestly. Like, we need you guys are all part of this team, because you play an important role, and you gotta hash it out and have the conversations, the hard conversations in those groups. So that has been a big learning for us. I would say the second piece that is hard in a matrix-based reporting structure is, typically, specifically in IS, leaders are promoted because they're subject matter experts and they like to lead. This really takes a little bit of that subject matter expert out, right? It really relies and gives that leader time to be a leader and really lead holistically for that employee. Hey, like, how is your work-life balance? Or are you making sure that, do you need any escalations with the work that you're getting done, versus handing work, task-based work every day, because the work is coming from a different leader. And I would say that was hard. That is hard. That is hard. It is a concept that we really have to work on, to continue to say, like, okay, this is going to be okay. Like, we understand. And it's a change for the leadership team, but I do think one that is good. So it allows people to have a leader, and not just a subject matter expert. It allows the leader to lead in a more cohesive fashion. And to me, that's super important, because part of the success of all this is really having a great team and making sure they understand that they're valued and an important part of the process, and that we hear them when they have feedback. And to do that, you've got to have that time to be that leader. So that was a big piece, and surprised that it was as hard as I maybe expected it to be. A little difficult, but it was much harder than I expected in the change management internally to IS. So, in technology, we're always making other people change. That's our job. We bring in new software, always adding new things. When we have to turn that table back internally to ourselves, we've got a little bit of change management to do too. And that was something that maybe I didn't expect it to be so much, but it has been a process. I realized it was much less about me telling the team how to change, and more how, once some teams started changing, them sharing their stories was an enormous win. It was much better received from the story sharing from peer to peer, than from me to say, like, hey guys, you're going to do this because we think it's a great idea. So those were probably my biggest learnings. And I'm really excited about it still. I do think there's a misconception about Agile being about moving faster. That is not the reason that we did this. We did this, we're actually moving a little slower, but we have a much more stratified, organized way to move change in, and really good ways to check KPIs on the changes that we are moving in. So I think understanding more about what the methodology is about, it was also a win that I didn't expect to really gain myself through the process.
Oh, I love that. I think it's so powerful to have that type of insight and reflection on the processes and everything that it takes in order to make these changes occur. Some of that organic transformation from the team out, and then understanding what it needs and what you need from people in order to function in a meaningful way. I just think it's such a powerful story. So thank you for sharing that with us. And I know, as you mentioned, always a work in progress. So
Always a
where
work
do
in
you
progress.
think where do you see things headed over the next year or so? How do you see those teams changing, continuing to evolve in your role as well?
Oh, great question. I mean, I think it's so, it's hard not to talk about what is, on the hype cycle of AI, but really watching how we are using the journey teams to develop our AI functionality in our current applications, as well as new and different. So, for example, the physician journey team manages for physicians and the adoption and the enhancements that are going on in that space. Really thinking through how we take those features and functions and embed that in the teams that we've created for evaluation and for adoption have been really neat to like think through. And as that is growing, like how can we manage it, making sure we're staying on top of things. I would say I am so excited about the possibilities for productivity in the IS space, in the corporate world, with the tools that we now have available, and really just how fast things are changing. I would say I've been in healthcare IT for like 20 years. In the last 20 years, seeing how fast we are able to adopt technology in healthcare is just really mind blowing. I mean, it was not like that 5 years ago, right? Like it was always like, oh, everybody else gets to do the cool stuff. Well, let us know when it's safe for us to use. And seeing that and watching that happen real time and maybe the technology is understanding a little bit of where our struggles were and why we couldn't adopt and the privacy of data. And seeing that really expand is exciting to me. And I think the possibilities are endless. And I think what 18 months from now looks like of our day to day is going to be totally different. And that is wild, like I am excited about it. I am a little fearful, but mostly excited of how we can do more that automation when possible and save our humans for what we need more humans to do. So I am pumped. I I'm excited about the near future. I would say we are really trying to find those efficiencies and those wins organizationally and be really smart about um, thinking through both the positives and negatives of what AI can do for an organization, specifically in a clinical space, and where we want to make some big bets, maybe on the corporate and financial side first, where there's less risk, and then really make sure our clinical partners in that space are well tested and follow our principles for AI as well. So.
Absolutely. And I really appreciate those thoughts on AI too, because it's just such a moving so quickly. The technology is moving so quickly and making an impact far larger than some of the disruptors of the past. And so it's really amazing to see the possibilities, but also, as you mentioned, some of the risk, with data privacy and all those kinds of challenges. So finding that push and pull and that balance is critical. And you talked about, leaders now, maybe they're not the subject matter experts in now bringing in AI technology as well. What kind of skills do you see the leaders of the future having? Where are you really leaning in, and who is kind of elevating because of skills that they had that perhaps in the past they wouldn't have been prioritized?
I think the change management is a big piece of that. Really just like understanding that things of today and tomorrow aren't going to look the same. And like, how can we embrace it and understand it and make it work for us versus um, shy away from it. I would say that has been a big thing for me. Understanding workflows is becoming more and more important. And when I talk about the subject matter experts, when I think about the skill sets needed to do some of the coding work or the build work is really changing. And it's more about understanding what is the problem you're trying to solve and how can you get there the fastest. So if you think about like prompts and the work that's happening in that space, again, like I'm get really excited about this because I really believe like we will be able to do more with less technical skill. So how do we prepare our leaders and our teams for what that looks like? It's a huge change, right? But we've got to prepare for it. So I would say open to change, willing to be flexible, willing to give 110% for our mission, and that's really important to me, which is like making sure we're delivering the best care to our patients. Those are things that kind of stand out as like in the job of healthcare IT or healthcare IS, you're working 24/7. A lot of times we're like, oh, something happened, or for us a hurricane, or there's a snowstorm in New Orleans that we weren't expecting. We've got to be prepared, and having a team of leaders that is always willing to like go that extra mile. I know with them, I can accomplish anything here. Like we can really do what we can, whatever we need to do. So that is a big piece for me is understanding and appreciating the mission and the vision of the organization and what we're trying to do in NIS as well.
I love that. That is amazing to hear, and it seems like just a lot of possibilities and potential and strong, opportunities for those who are excited about change and transformation. Before we wrap up here, I'm curious, when you look at the technology, obviously the rapid advancement and all those kinds of things, what do you see as being possible in 3 to 5 years because of technology that isn't possible today?
That's a great question. It's hard to ask. I don't envision that a lot of our day to day will have to be as planned out. I guess even for me, I'm looking at my work calendar, it's telling me what to do. Even already the tools that we have, the operational efficiency, I think gains are huge. Agentic AI to me in 3 to 5 years are going to be table stakes. Like that is just in the beginning, especially for healthcare, but there's just so much possibility there that it's hard to imagine what that can take us to and where that can get us. I do think predictive models, obviously, we're doing some of that today. That these are more things that I think that are cutting edge today, or the more innovative teams are doing. I think will be more everything will be in that space in a few years from a technology perspective. I imagine the clinic visit looking much different, and from a clinic side, really more technology, in-room technology. I feel like there's been a pretty big gap there as far as like our clinics look like the same clinics they look like 10 years ago. There's a computer and a desk in a corner and a table here and a chair here. Most clinics look like that. Like what tech can we put in there to really change that experience? And then hospitals, camera vision and hospital rooms of the future, automating documentation based off of what's happening in the room. Again, like big stuff, lots of privacy things, but the possibilities are just wow. I really think the refocus on, again, what do humans need to be focused on and less about the 1,000 tasks that the nurse or the physician has to do every day is going to be where we'll be in 35 years, much less.
I love that. Amy, thank you so much for joining us today. This has been such a fascinating conversation. And I've learned a lot already from everything you talked about. It really resonates, even what we're doing here at Becker's. And so I can imagine for our broader audience, just learned a lot as well. And I'm grateful for that. And I'm really looking forward to seeing you as well at our Health IT Digital Health and Revenue Cycle event in October. I know there's going to be so many sessions on a variety of topics, but it'll be great to continue this conversation and really have the opportunity to connect in person.
Awesome. Thank you for having me.